So can we use this for everybody? Not sure right now. So there is also an issue with the cost of the scope, but also I think we need some practice. We need to develop protocols. We need to have data, prospective data, and to make a final analysis, understand exactly how to use this in our standard practice. So the question is, do we require? Absolutely yes. We need a specific patient selection, and we know there are factors that are contributing to increase the risk of infection. So there are three main factors. One is patients related, the other one is the infectious agent, and the final one is environmental care. It depends also of the condition of the place where you're going to work, you're going to perform the RCP. So of course we try to define a list of high-risk patients, and we have patients who may be immunocompromised, they may have a transplant or advanced malignancies or having been treated already several times. So I don't think we can sort out right now a specific indication. What I tell to my colleagues here in Milano, this is right now is a very tailored approach. So we decide patients by patients. So we weigh the risk of infection, we weigh the risk of cross-contamination, either as a potential source or as a potential host of the infection, and we just tailor the indication. Having said that, I would say that probably in the near future, about 5 to 8% of our entire number of ERCP will be performed by EXALT, and probably we will progress to about 20% in just 12 months. There are different situations that can be suitable to this scope. So, and as I said before, it's a very tailored approach. When I see a patient who is very compromised, immunocompromised, or very sick, at a higher risk of infection, or a patient who is coming with a cholangitis infection, I just consider, I look to these patients and I try to understand whether or not this can be good candidates for ERCP with EXALT. In the list of immunocompromised patients, I was considering also patients using drugs that can reduce the level of immunocompetence of the patients. And of course, some of these ulcerative colitis guys, they may require ERCP because of the concomitant presence of sclerosing cholangitis. So I think this is a very good point.